Respiratory failure. Respiratory failure is a condition where the respiratory system fails to adequately exchange oxygen and carbon dioxide. There are four types of respiratory failures. Type 1 respiratory failure, also known as hypoxemic respiratory failure, it is defined by decreasing amount of PaO2 and decreased amount of PaCO2. The etiologies could be following. Alveolar hyperventilation could be seen in obesity hypoventilation syndrome, restrictive thoracic disorders, central sleep apnea. Lower fraction of inspired oxygen could be seen at the higher altitude. Diffusion defects could be seen in emphysema or the interstitial lung disease. Ventilation perfusion mismatch or VQ mismatch can be seen in ARDS, that is acute respiratory distress syndrome, COPD, congestive heart failure, pulmonary embolism. Right to left shunts, which causes severe pneumonia, uh, severe pulmonary edema, and arterial venous malformation. This all can cause type 1 respiratory failure. Let's talk about type 2 respiratory failure, which is also known as hypercapnic respiratory failure, and it is defined as decrease in the amount of PaO2, which was similar to type 1, but what the difference mean is in the PaCO2, the partial pressure of the carbon dioxide, which is high in this kind of respiratory failure. The etiologies could be inadequate respiration. It could be because of decreased central drive to breathe. Whenever we are given sedation to a patient, maybe opioid, alcohol, or benzodiazepines, it will just decrease the central drive to breathe. And whenever there is decrease in respiration, the body will will retain more amount of carbon dioxide in the blood. CNS dysfunction such as stroke, encephalopathy, malignancy can also lead to retention of carbon dioxide in the blood. Nerve disease such as Guillain-Barré syndrome, amyotrophic lateral sclerosis, botulism, tetanus, OP poisoning or organophosphate poisoning all can lead to reduced amount of inadequate respiration. Chest wall abnormalities such as kyphoscoliosis or the obesity, the muscular dysfunction, muscular dystrophy, dysfunction of the diaphragm, all this can cause inadequate respiration and can lead to retained carbon dioxide. Dysfunctional lung areas which are unable to undergo gas exchange, tachypnea where there is high respiratory rate, elevated carbon monoxide, increased metabolism seen in fever, illness, or exercise. All this can lead to type 2 respiratory failure. These two respiratory failure, these two types, first and second, these two are very common. Type 3 and type 4 are little less common. Let's talk about that. Type 3 respiratory failure. It is perioperative respiratory failure. It is defined as a subtype of type 1 respiratory failure in which there is decreased amount of PaO2 and decreased PaCO2, and it usually it occurs specially in association with an operation. So it is kind of a perioperative respiratory failure. Type 3 respiratory failure is also known as perioperative respiratory failure, and etiologies could be impaired breathing mechanics. It could be by general or the residual anesthesia, the supine or lying down posture, decreased cough reflex, upper abdominal incision, or the ascites all can cause impaired breathing mechanism. Suboptimal respiratory such as airway secretions can also lead to type 3 or the perioperative respiratory failure. Let's talk about type 4. It is usually shock with hypoperfusion. It is defined as a subtype of type 2 respiratory failure in which there is decreased amount of PaO2 and increased amount of PaCO2, and usually occurring when metabolic or the oxygen demand exceeds what can be provided. An etiology could be conditions with higher than normal metabolic demand such as septic shock, which is the most common, fever, illness, exercise, reduced cardiac output, could be cardiogenic shock, heart failure and other cardiac dysfunction, or the hypovolemic shock, dehydration or blood loss. But main thing that is associated with type 4, also known as shock with hypoperfusion, mainly the septic shock, is the etiology. Thank you.